Now, despite the progress made in fighting tobacco epidemic globally, there is still more action needed to help people quit these products. A new World Health Organization report shows many countries are still not adequately implementing policies, including helping people quit tobacco that can save lives. Tobacco use has declined over the years. Currently, there are an estimated 1.1 billion smokers, a majority in low and middle-income countries. With no strong tobacco control measures, the number of smokers in sub-Saharan Africa is projected to increase to 208 million by 2030. How many countries in the continent are undertaking legislations to control tobacco use? So far, 44 have committed to this, including Burundi, the Gambia, DRC, and Benin. Countries in Africa tax tobacco heavily to discourage use, putting excise tax revenues in 7 countries at $225 million per capita. Imagine that. Now, joining us in studio is Thomas Lindy. He's from the Kenya Tobacco Control Alliance. Thank you very much for joining us this afternoon. So with no strong control, tobacco products and the number of smokers in the continent is expected to go over 200 million by 2030. What can be done to contain this?
I think what the countries are doing is the correct thing. We urge more and more African countries to come up with strong laws, strong legislations that can protect their people. And it's good you have mentioned about taxes. We are fighting to ensure that the taxes are raised, and it's one of the ways to ensure that the affordability of tobacco products goes down, especially to those who poor household, so that money cannot be used to buy tobacco, but the money can be used for other things in their family. Yeah.
Some countries have implemented large graphic warning laws on cigarette packets, trying to discourage people from smoking. Do you think this really works?
Yeah, this really works. According to the World Health Organization, this is one of the cost-effective measures. It's not very expensive. If we have the graphic health warnings on cigarette packs, it will deter those that want to engage or induce themselves into the practice of tobacco smoking. And it will also help to prevent or deter those that are already smoking, so that they can see that this is what happens to my body. The graphic health warnings are supposed to be so graphic in that sense, so that if you can see at the pictures on the packs big enough, they can be able to prevent you from starting or continuing to smoke.
So briefly, countries heavily tax tobacco. Do you think that this will have an effect on government's revenues?
Yeah, it will have an effect. The government can get the revenue that it's so much needed. We see that so many of these African countries are suffering under the burden of diseases. And this revenue can help to alleviate some of the wrong things that the tobacco consumption and use in Africa, it has done, the devastating effects that it has brought to African countries. Yeah.
Thank you very much, Thomas.
Thank you.